Hi, I'm Dr. Tay Hin Ngan. I'm from Singapore. I'm a ear, nose, throat, head and neck cancer surgeon. I've actually trained in Singapore as a ENT, and then my further training was in Memorial Sloan Kettering, a cancer center in New York, for head and neck cancer surgery. Okay, so otolaryngology, as the name suggests, includes ear, nose and throat. So the conditions are very vast. They include simple conditions like just blocked ear, earwax, ear infections, to hearing loss. All right, for nose conditions, it can include things like allergic rhinitis, nasal polyps, chronic sinusitis, and nose tumors. And for throat conditions, simple things like just a sore throat, reflux, vocal cord nodules, vocal cord paralysis, and tumors of the throat. All these are all included under ENT. So it's actually a very broad field. Okay, so in general, the ear, nose and throat conditions are very common, and most patients will be seeing their family doctors first. And if, let's say, the condition does not resolve after about a month or so, in spite of treatment by your family doctor, that is the time to see a ear, nose and throat specialist, because obviously further investigation, further examination, and more advanced treatment may be necessary. Now, the warning symptoms, right, especially for head and neck cancer, they include things like blood-stained sputum. If you have a family history of nasopharyngeal cancer, thyroid cancer, if you're a smoker and drinker, which are risk factors for head and neck cancer, right? And of course, the tumor conditions including like sore throat, hoarseness of voice for a long time that doesn't go away. For large tumors, you may even have blockage of the airway, blockage of your food passage, causing you to have difficulty swallowing, difficulty breathing. And of course, if you have any lump in the head and neck area, like for example, a lump at the side of the neck, which might be lymph node involvement by cancer, or a lump in the center, which may be a thyroid nodule. So all these conditions are warning signs that you should see an ENT head and neck specialist to evaluate the symptoms. So sleep apnea is a very common condition and very often underdiagnosed. The commonest symptom is really snoring, and because a lot of people feel that it's normal to snore. But if you snore and you have other symptoms, like for example, when you wake up, you feel as if you've not slept, regardless of the number of hours that you've slept. If you feel very tired throughout the day, if you nod off for no reason when driving or when watching TV, or if you have, when you wake up in the morning, you get morning headaches, or if you have uncontrolled high blood pressure, you're difficult to control diabetes, heart disease, stuff like that should warn you that the snoring is not normal. So in those situations, we need to check for sleep apnea, and that's when your airway closes up when you're sleeping and you're not getting enough oxygen and it disrupts your sleep. Now, the reason why we need to investigate is because it causes a lot of problems with your health. It increases the risk of atherosclerosis, diabetes, hypertension, heart attack and stroke risk, right? In males, it can cause problems like erectile dysfunction, all right? And of course, it lowers your response time. You're more prone to getting into accidents and all that. So when we look at the 20-year survival, all right, there's a clear difference between someone with sleep apnea and someone without. So certainly, sleep apnea needs to be treated and diagnosed because it has an impact on your health and longevity. The way we investigate it is with a sleep study, and we do endoscopy to look at your airway, to look at where the obstruction is. And the treatment is typically with a CPAP machine, which is a positive airway pressure machine that you wear to sleep. Now, for patients who are unable to tolerate that or who wish to not use the machine, surgery is the second option. So just like in any other field of surgery, especially general surgery, ENT has progressed in the same way, and it is natural that what we used to do in very invasive manners, like for example sawing open the face, the jaw to reach areas where we want to remove cancer, Nowadays, we are going towards minimally invasive approaches. Initially, we did it with microscopes, we did it with endoscopes, and now we have the availability of the surgical robot. Now, in this particular case, what we use is the Da Vinci Xi system, which is the 4th generation robotic surgery system that we have been using. I personally have been using the Da Vinci robot since 2009 for robotic surgery, including surgery of the thyroid, surgery of the tongue base and the throat to remove cancer. So it's allowed us to do surgery without that massive invasive approach. So patients have better quality of life, and in the case of thyroid surgery, they don't need to have a neck scar. So you don't have your medical condition that anyone can see, right? And of course it reduces the social impact of having had surgery and all that. So certainly the advent of robotic surgery, the advent of minimally invasive surgery has allowed us to provide patients with better functional as well as aesthetic outcomes. For any serious condition that requires surgery, now we require both hardware and software to be in place. So for example, you need to have available instruments like the robotic system, endoscopic systems, and any technology that's available that helps us achieve minimally invasive outcomes. And we also need the nursing care, including in the OR, in the outpatient care and all that. So Mount Elizabeth Hospitals has both the hardware as well as the software to achieve the better outcome for our patients.